catagen hair and telogen hair. And the anagen is the growing phase, and it takes years, 2 to 9 years. The hair is growing, 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 growing. That's why you have to get it cut. Then it goes to a very short phase, which is the catagen hair. It could be a couple days, and then telogen hair, which could be a couple months. So what's happened is anything that alters this cycle, anagen, catagen, telogen, and then the hair falls. So normally you have about 100 hairs a day that actually are falling. When people come to my office, I say, how many hairs do you think you're losing? They're losing 25, 30 hairs. It's not significant. So you have to lose more than 100 hairs a day for it to be significant. Now, the characteristics, follicles can become larger or smaller, and androgens are very, very important regulators of hair loss. And you can shed, like I mentioned, from 50 to 100 hairs a day. So only if you shed more than 100 hairs a day is this a significant hair loss. And I have my patients count. It's tedious, but some of them, they do it on their own. They come in with little bags to show me that it is important. Every single day they count the hairs, and if it's more than 100, then it's significant. If it's not, we lose up to 100 hairs a day. So these are examples of females with hair loss, and this patient had iron deficiency anemia. This patient has the genetic type of hair loss. And this patient had an autoimmune disease, which is called lupus. So as you can see, not all of the hair loss is caused by genetics. Now let's look at the most important, which is androgenetic alopecia. Androgenetic alopecia, it's called androgenetic because it's genetic, and its typical onset, it's in puberty, in men in the 30s, and in women in their 20s, and it affects 50% of the population by the age of 50. So it's a big, big percentage of population that has this problem. This is probably the most common cause of hair loss that I see. It's telogen effluvium. And telogen effluvium is diffuse thinning, and it's very, very common in women. And one of the most common causes is iron deficiency anemia. So we always screen for iron levels in these patient population. So what can cause telogen effluvium? As you can see, the list is tremendous. And this is the type of hair loss that is caused by childbirth, any surgery, anything that affects you physically or mentally can cause hair loss. If you have a divorce, a death in the family, any major emotional trauma can throw you into what's called telogen effluvium. Any physical major problem, like a major surgery, bypass, any of these things can also cause hair loss. So as you can see, this is very, very common. And any of these thyroid disorders, some drugs, crash diets are very important nowadays, with a lot of the people going in this carb-free, low-fat, or whatever. These excesses of diets can cause hair loss. And all of these are caused telogen effluvium. The good thing about telogen effluvium is that this hair will grow back. Because remember, this is the hair that goes through the cycle that was going to fall. And every time that hair falls, there's another one coming. So that's why these people, we have to understand if they do have telogen effluvium, because this type of hair loss is reversible.